Hello, and welcome to Chapter 6, Virtual Lecture, Personal Care Skills. I am your instructor, Lakeisha Jennings, and I am going to walk you through Chapter 6. At any time that you have questions in regards to the content that is presented today, please feel free to reach out to your instructor via the classroom virtual stream. You may also send a personal message to your instructor through email, or you can write your questions down and bring them to class. But please know that we are always here to answer any questions that you may have. And so now we will begin. Follow along with me in your book, starting on page 124. We're going to start at part 1. What is personal care? Personal care is different from other tasks that nursing assistants may perform for residents, such as measuring vital signs or cleaning up a resident's room. The term personal refers to tasks that are concerned with the person's body, their appearance, and their hygiene. It is suggests that privacy may be important. What is hygiene? Hygiene is the term that we use to describe the way that the body stays clean and healthy. Bathing and brushing teeth are examples of hygiene. Another part of personal care is grooming. Grooming refers to practices like caring for fingernails and for your hair. Hygiene and grooming activities, as well as dressing, eating, transferring, eliminating, these are all called activities of daily living, which we talked about in the very first chapter. So, what are some of these activities and when are they performed? And so, on the screen and in your book, nursing assistants may provide the following care during the morning time: assisting with elimination needs and helping with perinatal care upon arising, helping residents to wash the face and the hands, assisting with hair care, dressing, and shaving, and also brushing teeth or mouth care. What are some of the care that is provided in the PM by a nursing assistant? Again, assisting with elimination needs, helping residents wash the face and the hands, giving a snack, assisting with mouth care or brushing teeth, assisting with changing into night clothes, and also you may be given a back rub, as well as bathing and showers. Always encourage self care when you are providing care, meaning allow the resident to be as self managing as possible. And before you begin anything, always check the care plan first. And so, how are we assisting with personal care? You will receive a guideline of steps that you must perform before care, during care, and after care. Always be sensitive and professional when providing care. Always explain what you are going to do. This will help prepare the resident so that they are ready for what you are going to do. Before you provide or before you begin any type of procedure, always provide privacy. How do we do that? Make sure you close the curtain or the doors. Some places may also have windows that faces the outside. So you want to make sure that you cover blinds and or curtains on those windows to provide privacy. Allow the resident to make as many decisions as possible. For example, if you are going to dress someone for the day, you want to make sure you ask them, what do they prefer wearing? That is honoring resident preferences. Throughout the care, you want to make sure that you maintain comfort and safety. For example, if you are giving a bath and you know sometimes that the water temperature or the room temperature may change, then you want to make sure the resident is kept warm at all times, especially if they are cold. And you also want to make sure you maintain resident safety when performing any type of skill. For example, If you raise the bed to working height, usually waist level, you have to make sure that before you step away from that bed, that you lower the bed back down to a safe height. Observe your resident during care. Note and report signs and symptoms. You've already learned some things that could be abnormal in Chapter 4. Observe the resident's mental state. Report any changes. Leave the resident's room clean and tidy. And leave the bed in the lowest position and always make sure the call light is within reach. Now, as you are performing care or any type of skill with your resident, you always want to promote resident rights. What does that include? Always promote residents' dignity, respect, and privacy during personal care by, again, encourage your residents to do as much as they are able to and be patient with them. Always knock and wait for permission to enter the resident's room. Do not interrupt residents while they are in the bathroom. Give them time. You can also give them a call light that should be located in the bathroom, so therefore they will call you when they are finished. If you feel at any time that the resident is at high risk for falls, still allow them to have privacy, but stand right outside of that bathroom. Leave the resident's room when they are on the phone or making phone calls. Respect residents' private time and their personal items. Do not interrupt residents while they are dressing. And keep residents covered whenever possible when helping them get dressed. So, when providing personal care, nursing assistants should observe for and report the following. If you remember in Chapter 1, we talked about that you are the eyes and the ears of the nursing team. You use your senses to detect things and to also report anything that is abnormal. So while you are providing care, this is a good time to observe the skin, its color, temperature, or any areas that is considered abnormal. We are also looking at their mobility, their flexibility, their comfort level or pain or discomfort, whether it is verbal or nonverbal, the strength and the ability to perform the activities of daily living, their mental and emotional state, and also any complaints that they may tell you. So now let's begin to look on page 125. We are going to identify guidelines for providing skin care and preventing pressure injuries. As we discussed in Chapter 1, prevention is key to good skin health. Once pressure injuries forms, it can get bigger and deeper and become infected. Pressure injuries are painful and difficult to heal. So what causes pressure injuries? Let's look on page 125. Immobility reduces the amount of blood that circulates to the skin. Residents who have restricted mobility are at greater risk of skin deterioration at pressure points. Pressure points are areas of the body that bear much of its weight. Pressure points are mainly located at bony prominences. Bony prominences are areas of the body where the bone lies close to the skin. The skin here is as much higher risk for skin breakdown. These areas include, and it's very important to know these areas, the elbows, shoulder blades, the tailbone, hips and knees, ankles, heels, toes, and the back of the head. Other areas at risk are the ears, the areas under the breast, or the scrotum, the area between the folds of the buttocks or the abdomen, and the skin between the legs. So on page 126 are just examples of different positions, that your resident may lie in. In these positions, or depending on the position that they are lying in, there are areas that are at risk for breakdown. Pressure on these areas reduces circulation, decreasing the amount of oxygen that the cells receive. In addition to that, warmth and moisture also adds to skin breakdown. Example, if you have a resident who is incontinent of urine and they are also wearing an adult brief, it's very important that you change that brief frequently. If not, the moisture from the urine and the feces will cause skin breakdown. Once the surfaces of the skin is weakened, injuries will occur and they can become infected. This can cause damage to the underlying tissue. When infection occurs, the healing process is now slow. The injuries that result from the skin breaking down and the shearing is called pressure injuries. We also have to be careful. Not only moisture causes breakdown, but also friction causes breakdown. Shearing is rubbing or friction that results from the skin moving one way and the bone underneath is remaining fixed or moving in the opposite direction. If we catch this early, this will prevent further breakdown. However, as a nursing assistant, you have to be able to recognize when a pressure sore is starting. So, number one, always keep in mind prevention. If you have a resident who is bedbound, unable to move, we know that that person is going to be at risk for skin breakdown. So you have to begin to put measures in place to prevent this from happening. One of the skills that we are going to learn today is how to put our resident in different body positionings or bed positions. When you look on page 126, figure 6.2, you actually see some of those positions. The most common position is the lateral position at the top, and the bottom is the supine position. These are very comfortable positions to help relieve pressure off of those bony areas. Again, prevention is key. If you have a resident who is bedbound, it's very important that we change these positions at least every 2 hours. That is an exam question. Patients or residents who are at risk for skin breakdown need to be repositioned every 2 hours. So, as a nursing assistant, you must be able to recognize when a pressure ulcer is forming. Here we go. Stage 1. Now, page 126 breaks down the different stages. It is important that you know what the first stage looks like. In stage 1, the skin is intact, but it may look red, and the redness is not relieved after removing the pressure. So, stage 1, you're going to notice redness. Darker skin may not look red, but may appear to be a different color than the surrounding area. The area may be swollen, painful, firm, soft, or warmer or cooler when compared to other areas around it. Again, you have to know what stage 1 looks like, and it is redness. If you notice this, number one, get to your nurse right away. Let them know what's going on. But I want you to start putting measures in place to prevent stage 1 from moving to stage 2. How do you do that? First, you start with the repositioning. Make sure that they have cushions whenever they're sitting in chairs, sitting up in bed. Stage 2 is partial thickness, which means you're going to have some skin loss. There is definitely a break in the skin. The area may appear to look like a blister. You can see a picture of this on page 127, and I will show you more. Stage 3 is full thickness, in which fat is now visible in the injury. You may notice that The wound now may be covered with other things, such as slough and eschar, which is explained on page 126. Stage 4 is full thickness. The skin loss is now extending through all the layers of the skin, tissue, muscle, and there's a possibility at this point bone is now exposed. This is a very deep pressure ulcer, and this causes a lot of pain. Again, your job is to know stage 1. But if your resident progresses to these other stages, now you have to begin to recognize what are some signs of that this pressure ulcer is now being infected. So things like odor will tell us if there is an infection. Other injuries that you may notice is something called an unstageable pressure injury, which means there's a break in the skin underneath the layers of the skin, but we can't stage it. Or you may have a deep tissue injury. That almost kind of appears to look like either uh, a blister that's filled with blood or some type of fluid, discoloration, or it may appear to look like a bruise. Let's look at some other pressure ulcers here. Here's an example of a pressure ulcer on a person's ear. How did this happen? Could be many reasons. Lying on something, you may have residents who have oxygen tubing. And so what happens is if they're laying on that tubing for too long and nobody's repositioning them, it's going to begin to cause breakdown. This may be an example of a bruise or a deep tissue injury. This is an example of multiple pressure ulcers. As you see, this person has pressure ulcers on all of the bony areas, the hip, the knees, and between the legs, and also the heels and the ankles. This is an example of a pressure ulcer, maybe a stage 3, that is on the buttocks or the tailbone. This is an example of a pressure ulcer on the heel. This is an example of a pressure ulcer also on the tailbone. These are items that we use to help float the heels. What does that mean? To provide cushion for the heels so that the heels are not laying on the bed, being a product of friction or shearing. So as you see here, positioning is very important. But when you are positioning your resident, you have to make sure that you are protecting those areas that are at high risk for breaking down. So while observing the skin, here are some things to pay attention to. Do you notice pale white or red areas? Are there blisters? Do you notice any difference in the skin temperature? Is your resident complaining of tingling, warmth, or burning? Is the skin very dry, cracked, or flaking? Is it itching, or are they scratching? Do you notice a rash or any type of skin discoloration? Is there edema or swelling? Do you notice any fluid or blood draining from any area? Is the skin broken? If your resident has an existing injury, did you notice that it got bigger? Does it have an odor? Here are some guidelines to remember when providing skincare. Number 1, always check the care plan first. But report changes in the resident's skin to your nurse. Provide regular skincare. Reposition often, at least every 2 hours. Give frequent skincare for residents who are incontinent. And change clothing and linen often. Avoid scratching or irritating the skin. Report blisters or sores on the feet. This is very important. This is why we tell nursing assistants, especially our females, to keep the length of your nails down. This will prevent any type of scratching or irritation to the skin. Massage skin frequently, but do not massage white, red, or purple areas. Again, follow the care plan first. Avoid pulling or tearing the skin. If your resident is overweight, make sure you pay special attention to any skin that are under folds. Encourage residents to eat well-balanced meals and to drink plenty of fluids. Keep plastic or rubber materials from coming into contact with the skin. Always, always follow the care plan. For bedbound residents who are at high risk for pressure ulcers, when you are caring for them, keep the bottom sheet tight and free of wrinkles and crumbs. Avoid sharing. Place an absorbent pad or bed pad under the back and the buttocks. Relieve pressure on those bony prominences by using pillows and other cushion devices. Make bed or chair softer with flotation devices. If your resident likes to sit in a chair, just like we reposition every 2 hours in the bed, you want to position about every hour in those chairs, especially if they cannot reposition themselves. Here are some other positioning devices that can help keep residents very comfortable and also to reduce the risk of skin breakdown. You'll notice back rests or bed cradles, draw sheets. All of these items we will definitely show you in class. Footboards, hand rolls, orthotic devices. You see an example of this on page 129. Hand rolls that you see on page 128. Trochanter rolls or abduction pillows. Now, we are going to begin the guidelines of assisting with bathing. Page 129, part 3, says that bathing promotes health and well-being. It removes perspiration, which is sweat, dirt, oil, and dead skin cells from the skin. It helps to prevent skin irritation and body odor. Bathing can also be relaxing. The bed bath is an excellent time for moving arms and legs. It increases circulation. It also gives the nursing assistant an opportunity to fully observe the resident's skin. Residents may have a bath in bed, or they may take a shower, or they could have a tub bath. They may have something called a partial bath, which is a bath given on days when a complete bed bath or tub bath or shower is not done. This includes washing the face, the hands, the underarms, and the perineum. What is the perineum? The perineum is the genital or the anal or rectal area. Here are some guidelines for bathing. Baths, again, are for health and relaxation. Be gentle with the skin when bathing. Only use facility approved products. Even though you may be tempted to bring your own, only use facility approved products. Residents may have allergies that you are unaware of. Keep the room temperature comfortable and be familiar with safety and assistive devices. Now, before you begin to bathe your resident, gather all your supplies first. You do not want to leave them alone while you are bathing them. Before you introduce water to anyone's skin, make sure that the water temperature is safe and comfortable. Once you are sure of that, have your resident test the water temperature as well. That is very important and a very important step in your skill. Wear gloves while bathing a resident and change gloves before giving perineal care. Remove all soap from the skin and keep a record of bathing schedules. Again, resident has choices and preferences as to when they want to take a bath. Most of your facilities will probably have a schedule for them. But when you have residents who are beginning to refuse their baths, you want to make sure that you're checking with them to see when is a good time to take a bath. What is the equipment that you need for bathing? Now, we teach you how to perform these skills to make sure that you pass your state exam. But these steps and skills also apply to the real world. So you want to make sure you have a bath blanket. It is a very thick blanket that will provide warmth during your bath. You need a bath basin. You need soap. You need about 2 to 4 washcloths. When doing our partial baths in class, I recommend that you have 4 washcloths, 2 to 4 bath towels, You also want to have a disposable absorbent pad or another towel, and also 2 pair of gloves. In the real world setting, of course, you will probably have lotion, deodorant, brushes, combs, etc. Whenever you are bathing your resident, always be gentle and natural. Avoid force or overextension of any limbs or joints. Always identify yourself first, identify your resident, and wash your hands. And always explain what you're going to do. Make sure you provide privacy with a curtain screen or a door. And be sure the room is at a comfortable temperature and there are no drafts. Adjust the bed to a safe level, usually about waist high. Make sure that the bed wheels are locked. This picture is an example of providing a bath blanket or a towel over the resident. You can ask them to hold this so that way you can remove the gown or any sheets or anything that is underneath them. You want to make sure you place any clothing or soiled items in the proper container. We never place soiled linen on floors. We place them directly into the bags or directly into a linen hamper. When it is time, make sure you test the water temperature. Your book mentions a thermometer, but many places do not have that. Then allow your resident to test the temperature. Make sure you prepare your workspace. Your bed is at a good level. You have your water and all your supplies. I also recommend that you place a barrier on top of your resident's bedside table. So that way you can prevent anything that is soiled from getting onto their tables. You can use a towel or you can use an absorbent pad for that. Put on your gloves. Ask the resident to participate in washing. How? Ask them if they would like to wash their face or help them when needed. Begin with washing the eyes, the face, ears, and the neck. There is a video that is attached to this lecture that will show you how to give a bed bath. The bed bath that you see here in your book is actually a complete bed bath, which means that you're going to wash from head to toe. During your complete bed baths, you may be asked, or the care plan may ask, to not only wash the back, but to also provide a back rub. After you have washed your resident with soap, you will then rinse. After rinsing, you will pat dry. The bed bath we will be performing is called a partial bed bath. Another skill that is also required of you to know is performing something called perineal care. We've already discussed that the perineum area, or peri area for short, includes the genitalia and the rectum. For a female resident, using water and a small amount of soap will wash the front and the back of the perineum. What you need to be aware of is that when you are washing the perineum, you have to change spots on your towel. You cannot wash different areas with the same spot on that towel. That is recontaminating the perineum. Whenever we are washing the perineal area, always wash from front to back. When you have a resident lying on their back, it looks like you will be washing them from top to bottom. When you are washing your male resident, if the resident is uncircumcised, pull back the foreskin first. Gently push skin toward the base of the penis. Hold the penis by the shaft. Wash in a circular motion from the tip down to the base. Use a clean area of the washcloth or clean washcloth for each stroke. What does that mean? You're going to change spots on the towel. After you have cleaned this area with soap, you are going to rinse in a similar fashion. Once you are done, you are going to pat dry. Make sure you remain or maintain the resident's comfort and safety throughout the procedure. Place all of your soiled clothing and linens in its proper containers. Remove and discard your gloves and wash your hands. Make sure you provide the call light within residents' reach and report any changes to your nurse and document according to your facility guidelines. When it comes to using any type of lotions or moisturizers, we always check with the care plan first. Here is an example of giving a back rub during your bath. There are times that you may be asked to shampoo hair. This may be done during a shower. Many of your facilities will have salons, but you have residents who may wash their hair and condition their hair every day. You may even be asked to style as well as blow dry and curl. Here is an example of how to shampoo hair in a bed. Again, whatever your facility has for this, you want to make sure that you follow your facility's policy. Remember, here's a safety check. It is very important to check the temperature of the water and have the resident check the temperature of the water before bathing. Bath water should be changed when it becomes too cool, soapy, or dirty. There is a way to prevent this from happening. And so we're going to show you this in class. Perineal care, or cleaning of the perineal area, is a procedure. It may need to be done even if a full or partial bed bath is not needed. Times that your resident has incontinent episodes or need to go to the restroom are the times that you will be performing perineal care. Again, always clean from front to back. Always perform perineal care as a step-by-step technique with different steps for males and females. Always turn the resident onto their side to clean the anal area and clean the anal area without contaminating the perineal area. Always provide privacy and dignity by keeping body parts covered with towels and blankets. Keep the resident warm. Procedures such as nail care, shampooing, and back rubs are often done at the time of bed baths. You also will have nail care and foot care that could be performed and may be performed separately. For state testing purposes, foot care, nail care, bed bath, and perineal care are all separate skills. We teach you that way so that way you can become comfortable with those skills. Of course, you can combine all of these skills in a real life setting. So here are some safety guidelines when you are dealing with showers and tub baths. Clean the tub or shower before use and after use. Your facility will have some type of disinfectant spray to make sure that is done. Before you leave or have your resident transfer from a shower chair to a wheelchair, make sure the floor is dry. Be familiar with how to use the shower and any assistive devices as necessary. Have the resident use safety bars to get into and out of a tub or a shower. Always place items within reach. Do not leave the resident alone. Even though your resident may be independent, I still stand behind the curtain. Do not use bath oils, lotions, or powders unless this is something that is on the care plan. And again, test water temperature to make sure it is safe and comfortable. Your book now walks you through how to give a tub bath or a shower. You want to make sure that you follow the guidelines at the facility in which you work. Wash your hands, place equipment in the shower or the tub room, put on your gloves, make sure that shower or tub area is clean and it has a chair. Always explain to your resident what you are going to do and provide privacy by closing the curtain, screen, or the door. This is an example of a shower chair. If you're going to use this, make sure that the wheels are locked before transferring your resident to this chair. Again, test your water temperature. Allow your resident to do as much as possible. You can also assist them with shampooing and rinsing their hair. For tub baths, you want to follow your facility's policy. During your day and caring for your resident, you are definitely going to be assisting with grooming. Page 138, Part 4 says grooming affects the way people feel about themselves and how they look to others. When helping with grooming, nursing assistants should always let residents do all they can for themselves. Residents should make as many choices as possible. Residents may have particular ways of grooming themselves. They may have routines. These routines remain important even when people are elderly, sick, or disabled. Some residents may be embarrassed, depressed, or anxious because they need help with grooming. Nursing assistants should be sensitive to this. Being respectful promotes person centered care. So, the first skill you see for grooming is providing fingernail care. When providing fingernail care, again, always explain what you're going to do. You provide privacy with a curtain screen or a door. If the resident is in bed, adjust it to safe working level, lock your bed wheels. This skill involves the use of water as well. So you want to make sure you test the water temperature and then have your resident test the water temperature. Put on your gloves. Soak the resident's hand and nails in a basin of water. Soak all the fingers for at least 5 minutes. When we perform this skill in class, you will only use one hand. You want to remove hands from the water and now begin to wash the hands with a soapy washcloth. You want to rinse and then pat hands dry with a towel, including between the fingers. Again, remove the hand from the basin. With this procedure, you also want to have a barrier placed down on your table because now we're going to place the resident's hand on that barrier. And we're going to begin to now clean under the fingernail with something called an orange stick or a wooden stick. Each time you wipe the orange stick on a towel after cleaning each nail. Shape the nails now with an emery board or a file. Move only in one direction, and each time you finish each nail, check to make sure that it is smooth and free of rough edges. According to care plan, apply lotion from fingertips to wrists. This is a good time for a nice massage. Once you apply the lotion, you want to take a towel to remove the excess. Once you have completed your procedure, you want to empty, rinse, and dry your basin and place it back in its designated area. Put away your soiled items, again, linen hampers or bags. Remove and discard your gloves and wash your hands. Make sure you put everything back. Bed in its lowest position, call light within easy reach, document what you have done, and then report any changes to your nurse. You will also be asked to perform foot care. Now, usually in healthcare settings, we don't separate this. This is something that is probably done during a bath or a shower. But for testing purposes, we will do foot care. When providing foot care, it is very important to know your residents who are diabetics. We do not clip toenails or do any filing to the foot. That is left up to the professionals. Usually a podiatrist or a foot doctor will be the one to care for the foot. So you're looking for any dry or flaking skin, broken skin, any type of discoloration, blisters, bruises, or any type of blood or drainage. You're looking for toenails that are long and ragged, ingrown, or if you notice any swelling, redness to the heels, or differences in temperature. Just like nail care, you're going to need a basin, a bath mat or a barrier, soap, lotion, two washcloths, two towels, clean socks, and your gloves. Always explain what you're going to do, provide your privacy, and adjust the bed if you need to. This procedure will be performed in a chair. You want to fill that basin up with water, you test it, and have your resident test it. Now, place your basin on a bath mat or a bath towel, which is going to be on the floor where the resident is sitting. At that time, you want to make sure the basin is in a comfortable position for the resident. Support the foot and ankle throughout this procedure. Put on your gloves. Remove resident socks and completely submerge the foot in the water. Soak for at least 10 minutes. Add warm water to the basin as necessary. You want to now remove the foot from the water and wash the entire foot, being careful to hold the foot over the towel. Please make sure you wash in between the toes. With a clean dry towel or washcloth, after you have rinsed the foot, dry the entire foot, even between the toes. Put some lotion in your hand, rub it together, that warms it up. And now you're going to begin to massage the lotion into the entire foot from top to bottom, except between the toes, and remove excess, if any, with a towel. Help the resident to put on their clean socks, and now you can begin your procedures for emptying, rinsing, and drying your basin and placing all of your soil items in its right place. Document and always make sure you tell your nurse if there is anything abnormal. Here are some points on hair care, page 141. Let residents choose their own hairstyles. They will usually tell you. Do not style residents' hair in a childish manner. Handle the hair very gently. Equipment you'll need for this is a comb, brush, a towel, a mirror, and maybe some hair care products or items that is requested by the resident. Use hair care products that the resident prefers for their type of hair. Always identify yourself. Wash your hands and explain what you're going to do. Again, provide privacy. Be very gentle when you are brushing and combing the hair. You want to make sure you're paying attention to the scalp. One of the things that we've talked about in earlier chapters is body lice, or your book, page 141, calls it pediculosis. That is an infestation of lice. Lice are tiny bugs that bite into the skin and suck blood to live and grow. There are three types of lice. You have head lice, you have body lice, and crab or pubic area lice. Head lice is usually found on the scalp. They are hard to see, but symptoms does include itching, bite marks on the scalp, skin sores, and matted, bad-smelling hair and scalp. Lice eggs may be visible on the hair, between the ears, or on the neck. They are small and round and may be brown or white. Lice droppings look like fine black powder. They may be on sheets or pillows. If the nursing assistant notices any of these symptoms, they should tell the nurse immediately. Lice can spread very quickly. Special creams, shampoos, lotion sprays, and special combs may have to be used to treat people who have lice. People who have lice can spread it to others. So, to help prevent the spread of lice, the resident's comb, brushes, clothes, wigs, and hat should not be shared with others. Here are some pointers on assisting a resident who is shaving. Page 142 says, personal preferences for shaving must be respected. The nursing assistant should make sure the resident wants her to shave him or help him shave. Remember, when shaving, it is not just for a male, but it can be for a female as well. Nursing assistants must wear gloves and when shaving residents due to risk of exposure to blood. Razors should not be shared between residents. There are different types of razors that is used for shaving. The first one is a safety razor. It has a sharp blade, which come with a special safety casing to help prevent cuts. This type of razor will require the use of shaving cream or soap. A disposable razor requires shaving cream and soap, and it is also discarded in a biohazard container for sharps after use. An electric razor is the safest and easiest type of razor to use. It does not require soap or shaving cream. When you are shaving a resident, respect their personal preferences. For example, you may have residents who do not use shaving cream and only want soap. You have residents that want shaving cream applied directly to the skin, or you have residents who may want water put on their face first. These are all personal preferences. Some residents do not want their beards shaved or mustache. Again, these are personal preferences. Wear gloves. Do not share razors. Soften hair on face first if using a disposable or a safety razor. Shave in the direction of hair growth. Use aftershave lotion if it's desired. And discard disposable shaving products properly. Do not use electric razors near any type of water or if your resident is wearing or using oxygen. Here are some of the equipment that is needed for shaving a resident. You need a razor, a basin of water, 2 towels, a washcloth, a mirror so they can see it, shaving cream or soap, and aftershave lotion if desired. And of course, you always want to wear gloves. When you are shaving a resident, always provide privacy. Again, shave in the direction of the hair growth. Residents will tell you what areas they want you to shave. Here is an example of a resident who is able to shave himself, but just uses a little bit of help from a nursing assistant. Offer a mirror so the resident may be able to see. Apply aftershave if the resident wants it. Page 143 is another skill that you may be asked to perform. It is assisting residents who are getting dressed. Dressing and undressing residents is an important part of daily care. When helping with dressing, the nursing assistant should know what limitations the residents have. Residents may have one side of the body that is weaker due to a stroke or injury. We discussed that in chapter 4. When there is a weaker side or an affected side, we also call it the involved side. The nursing assistant should not refer to the weaker side as the bad side or talk about the bad leg or the bad arm. When dressing, the nursing assistant should begin with the weaker side of the body. I will repeat that because when we are performing our skills in class, the scenario is you're dressing someone who has a weaker side. When you are dressing someone who has a weaker side, you dress the weaker side first. There are many types of items on page 144 or aids that will help or assist the residents in grooming themselves. We will discuss that further in chapter 9. Whenever you are dressing a resident or assisting them with dressing, allow them to make choices of the clothes that they would like to wear. Equipment also includes a bath blanket and non-skid footwear. Always explain what you're going to do and provide resident privacy with a curtain screen or a door. It is also important to keep the residents covered during the times you are dressing them and never to overexpose, kind of like the picture that you see in page 144. When dressing a resident, and I am on the screen with an IV, A nursing assistant should remember this. Never disconnect IV lines or turn off a pump. Always keep the IV bag higher than the IV site. We have an example of this in class. First, remove clothing from the side without the IV. Then gather the clothing on the side with the IV. Lift the clothing over the IV site. Move it up the tubing toward the IV bag. Lift the IV bag off its pole. Carefully slide the clothing over the bag and place it back on this pole. Again, we have an example of this in class. When you are applying clean clothing to a resident who has an IV, you want to apply first to the side with the IV. Slide the correct arm, opening over the bag, then allow the tubing and the resident's IV arm, then over the tubing, place the IV bag back on the pole. Check that the IV is still dripping and make sure none of the tubing is dislodged. There may be times that you may have to apply something called anti-embolic stockings. You may be remember or familiar with TED hose. That's an example that you see on page 146 and 147. Anti-embolic stockings can help prevent swelling and blood clots and add circulation. They should be applied to in the morning before the resident gets out of bed, so there is less swelling in the legs throughout the day. These can be very difficult to put on, so it's helpful if you put these stockings on when the resident is in the supine position, that is, lying on their back. It helps to turn the stockings inside out, at least at the heel area. Once you slide it up, it makes it easier for you to slide the entire stocking on the leg. Now let's discuss oral care. Page 147. So when providing oral care, your book says on part 6, oral care or care of the mouth, teeth, and gums is done at least twice daily, each day, to clean the mouth. Oral care should be done after breakfast and after the last meal or snack of the day. It may also be done before a resident eats. Oral care includes brushing the teeth, tongue, and gums, flossing and caring for the lips, and also caring for the dentures. When given oral care, nursing assistants must wear gloves. They should follow standard precautions. Here are some examples of giving oral care. When you are providing oral care, you want to observe for the following. If you notice any type of irritation, soon you will begin to learn signs of dehydration. But if you notice that the tongue is swollen or coated, there's sores and ulcers or white spots, bleeding or chapped lips, decayed or broken teeth, any type of swelling, bleeding, or irritated gums, bad or fruity breath, and we know that fruity breath could also be an indication of diabetes, or any type of reports of mouth pain. When providing oral care for someone who is unconscious, resident, nursing assistants must remember regular oral care will keep the mouth clean and moist. Again, we will show you this in class. So here are some steps of providing oral care. The skills that we will perform in class will be brushing teeth and also denture care. Dentures is artificial teeth. Residents who have dentures also will need to have their gums cleaned as well. Here is an example of providing oral care to a resident who is unconscious. Here is an example of flossing teeth. Now, here are some important guidelines to remember about denture care. Dentures are very expensive, so you want to handle them with care. When you are handling or cleaning dentures, always wear gloves. Report problems with the dentures to the nurse right away. Do not use hot water to clean dentures because it may damage them. Place dentures in the labeled cup or return them immediately to the resident to be put into their mouth. When you are doing and performing denture care, you want to make sure you have a special denture brush or a toothbrush, denture cleanser or toothpaste, and a labeled denture cup, two towels, and gloves. One of the towels will be used to line the sink or basin with a towel. This is because if the denture falls or drops, it can float instead of breaking. Hold them over the sink and rinse them clean. Do not use hot water. You can apply your toothpaste or denture cleanser using your denture brush, and you are going to brush all surfaces of the dentures. Again, you notice that there is a towel lining the sink. When you are finished cleaning them, your dentures or your residence dentures, place them in a denture cup with some cool solution or water, or return it immediately to your resident. Make sure you cover the dentures with any solutions that you may use. At any time that you have questions in regards to the content that we have discussed today, please feel free to reach out to your teacher or your instructor. Now, let's look at page 152. We're going to talk about how to assist residents with using the bathroom. Residents who are unable to get out of the bed to use the toilet may be given a standard bedpan, a fracture pan, or a urinal. A fracture pan is a bedpan that is flatter than the regular bedpan. It is used for residents who cannot assist with raising their hips onto a regular bedpan. Women will gently use a bedpan, will generally use a bedpan for urination and bowel movements. Men will use a urinal for urination and a bedpan for bowel movements. Elimination equipment is usually kept in the bathroom between uses. Residents who share bathrooms may need to have urinals and bedpans labeled. This equipment must never be placed on overbed tables or on top of side tables. Urine and feces are considered infectious waste. Nursing assistants must always wear gloves when handling bedpans, urinals, or basins that contain waste, including dirty bath water. Nursing assistants should be careful not to spill or splash waste, and waste should be discarded in the toilet. Immediately after use, containers used for elimination should be placed in the proper area for cleaning, or they should be cleaned and stored according to facilities policy. So your book will now walk you through how to use a bedpan. Whenever you are using a bedpan, first, you're going to explain what you're going to do, provide privacy for your resident, make sure you wash your hands before touching your resident, gather all of your supplies, pay very close attention to the supplies that you will need. You will need a bedpan, something to cover the bedpan. You need a disposable bed protector, which you see on this picture, a bath blanket, toilet paper, hand wipes, towels, and 2 pair of gloves. The extra towels will also be to help perform any type of pericare that may be needed after this is done. When you are placing your resident on a bedpan and you have your standard, which is here, bedpan, you notice that the resident is going to sit on the wider end. You can have your resident turn to their side, or you can have your resident raise their hips. After your resident is done using the bedpan, you want to make sure you offer them a hand wipe And please make sure they have toilet paper nearby. Some residents can wipe themselves, but if not, you have to be prepared to perform perineal care. This is an example of assisting a male resident with a urinal. Hand the urinal to the resident. If the resident is not able to help himself, place a urinal between his legs and position the penis inside the urinal. Replace covers. Remove and discard gloves and wash your hands. There are times that you may have to assist your resident to use a bedside commode or a portable toilet. We've showed you a picture of this earlier in the chapter, but you can look on page 156. These are examples of bedside commodes or portable commodes. The bottom picture is an example of a bariatric commode. This is used for people who are overweight or obese. There are times that you may have to give an enema. An enema is used to help relieve constipation. If you have to do this or perform this, you will be specially trained to provide the enema as well as to perform it. This is an example of an enema. And again, it is used to relieve constipation. Okay. And as we close from this chapter, let's start on page 157. We are going to now begin how to move your resident around in bed. We're going to be doing lots and lots of practice in class, so don't worry. Okay. Part 8 explains guidelines for safely positioning and moving residents. We've already talked about residents who spend a lot of time in bed. They often need help into different positions. These positions need to be changed quite frequently to avoid stiffness of the muscles and skin breakdown. Positioning means helping residents into positions that promote comfort and health. Pressure ulcers will occur if the resident is not positioned, but also there are other injuries or problems that may occur from lack of mobility. For example, muscle contractures. So here are your different positions that you see here. Supine is the first position. Supine is a body position in which a person lies flat on their back. The next position is the lateral or lying on either side. Please highlight this one. This is going to be a skill that you may be asked to perform on your state boards. Number 3 is the prone position. This is lying on the stomach. Number 4 is the Fowler's position or a semi-sitting position. Number 5 is a Sims position, kind of like a left side lying position. You will often be involved with moving a resident around in bed. Different ways that you can do this, and you can follow along in your book on page 158, is you may have to move a resident up in bed. And again, we will show you how to do this. If this is a case, identify yourself and wash your hands and explain what you're going to do. Always provide privacy. You want to make sure you adjust the bed to safe level and lock the wheels. When we're moving a resident in bed, we always lie them flat. We move pillows to the head of the bed so that it is prepared when the resident is moved up. When we're doing this, we are going to use a draw sheet to perform this procedure. If you don't have a draw sheet, you can also make one. Again, we will demonstrate this for you in bed. There are often times when you have to move a resident to the side of the bed, and that's without a draw sheet. And so looking in this picture, you see that your nursing assistant is using wonderful body mechanics. There are often times that you are going to reposition your resident onto their side. Page 159 walks you through that skill. Don't worry, we're going to perform this in class because this is going to be a state board skill. Page 160 and 161 talks about log rolling. Log rolling means moving a resident as a unit without disturbing the alignment of the body. The head, back, and legs must be kept in a straight line. This is necessary in cases of neck or back problems, spinal cord injuries, or after back or hip surgeries. It is safer for two people to perform this procedure together. Again, a draw sheet will be used and is helpful for moving. Page 161 shows you an example of log rolling. Page 162 talks about sitting a resident on the side of the bed, also known as dangling. And I'm just going to get to the picture here and show you that's log rolling there. And this is assisting a resident to sit on the side of the bed or to dangle. Again, body mechanics is very important. Now, we've already talked about body mechanics, and I'm on page 163. But other things that we have to do is transferring. Transferring a resident means that a nursing assistant is moving them from one place to another. Transfers can move residents from a bed to a chair or a wheelchair, from a wheelchair to a shower or a toilet, and so on. But safety is one of the most important things to consider during transfers. Again, before you begin any move, you always want to check the care plan first. Ergonomics is a science of designing equipment, areas, and work tasks to make them safer and to suit the worker's abilities. OSHA, which you learned in Chapter 2, states that the manual lifting and transferring of residents should be reduced and eliminated whenever possible. What does it mean when we say manual lifting? That means lifting them on your own. Manual lifting and transfers and repositioning of residents increase the risk of injuries, not just to your resident, but also to you. To reduce injuries, many facilities have adopted the no lift, zero lift, or the lift free policy. These policies set strict guidelines for lifting and transferring of residents. Lift free policies may vary. Some facilities do not allow lifting at all and require that equipment always be used when lifting and moving residents. The more restrictions placed on lifting, the less chance there is an injury. Nursing assistants, again, must follow facility policies on lifting and the use of equipment properly. A transfer belt is a safety device used to transfer residents who are weak, unsteady, or uncoordinated. It is also called a gait belt when it is used to help residents walk. The belt is made of canvas or other heavy material. We have examples of this in class. The bottom picture that you see on page 163 is a slide or transfer board. It may be used to help transfer residents who are unable to bear weight on their legs. Slide boards can be used for almost any transfer that involves moving from one sitting position to another. Slide boards should not be used against bare skin. Here is an example. Other things that we use to help with transfers is the use of wheelchairs. Here are some guidelines on page 164 and on your screen on how to use wheelchairs. Know how to use the brake, the armrest, and the footrest. Lock before you transfer, unlock afterwards. That's very important. I'm going to repeat it. Lock before you transfer them, unlock afterwards. Open by pulling on both sides, close by lifting the center seat. We are going to show you in class on how to use a wheelchair. Other things that you may have to be able to do on page 165 is to assist a resident who is falling. You never want to stop or break the fall, but bring the resident's body close to you. Bend knees and support the resident and lower them from the floor to the floor. And always call for help. Do not attempt to get the resident up. One of the skills also that you are going to have to perform is transferring a resident from a bed to a wheelchair. Again, we will perform this for you in class. However, there is a video that is attached to this. Lastly, on page 167, talks about the use of mechanical lifts. At the top of page 167, facilities often have mechanical, also called hydraulic power or standing lifts available to transfer residents. This equipment helps prevent injury to residents and staff members. Nursing assistants may assist residents with many types of transfers using a mechanical lift. Using these lifts requires special training. Nursing assistants should not use equipment they have not been trained to use, as this could cause injury. There are many different types of mechanical lifts. You see pictures of this on page 167. Nursing assistants should always ask for help if there is anything they do not understand about the lift. Let's go over just a few guidelines when we are dealing with mechanical lifts. It is safer for two people to transfer with these lifts, and two people most of the time is required. Never try to use a mechanical lift by yourself. Many complaints that I hear is that I cannot find another CNA to help me with this lift. But guess what? You have nurses, you have therapists, you have other people who are highly trained and qualified to assist with a lift. When you are handling a lift, you always want to make sure that the batteries are charged if it's not a manual lift. If not, this can cause a tragic situation. Keep chair or wheelchair near bed to only move the resident a short distance. Use the correct sling for the correct lift. The example of a sling is on page 167. It is blue. Again, we will show you how to operate the lift in class. Here is an example of a full body mechanical lift or hydraulic lift. Two people is also required to perform this. The resident is laying on a sling, and the sling is being attached to the actual machine. So, as you see, we have many things that we're going to be doing in chapter 6. So, your job is to be prepared when you come to class. It is recommended that you take your index cards or your notebooks, write down each one of your skills. When you are writing your skills down, you want to include the name of the skill, the supplies that's needed, and then watch your video to make sure that you understand the steps. Each day that we meet in class on our skills days, we would only be performing 3 to 4 skills. Prior to coming to class, it is required of you to watch the videos. So that way you are ready to practice your skill. Always know that you're not going to perform your skill perfectly the first time. We as an instructors understand that. However, as the day go by and as the week is going by, you will be perfecting your skill and you will be ready to officially check off your skill. Again, you must come to class prepared. If you have any questions, please feel free to reach out to your instructor. Follow your syllabus and the calendar that is within your syllabus so you will know which set of skills we will be working on first in class when we do meet. Again, you must be prepared. Thank you for listening, and we hope to see you soon.